Welcome, ladies and gentlemen, in the EHRA studio. Today we have two guests, Dr. Pierre Jaïs and Dr. Miyazaki, and they have presented today two trials in the late-breaking science sessions. So we'll start with Dr. Jaïs. You presented today the outcomes of the BEAT-AF trial. Could you please summarize it?
Yes, thank you, Natasja. So this is a non-comparative trial randomizing pulse field ablation versus RF ablation using the closed protocol to isolate the veins and create a posterior lesion in the left atrium. And it's a small trial. We wanted to generate data for future trials.
And what is for you the biggest surprise which came out of the trial?
So we've got a 65% success rate at 1 year, single procedure with PFA versus 55%. So there is a sign that PFA might be superior. It's not a firm conclusion here. The biggest surprise came from complications. We had almost 20% complications with RF as compared to 2% with PF.
And when you look at your data, what is for you now the biggest uncertainty which is still out there?
You know, we still don't really know how to approach persistent AF. I suspect that pulse field ablation will do better than thermal energies, but the ablation scheme remains unknown.
Yeah. And would you say that the outcome of your trial is now practicing changing for you?
Yeah, so the thing we noticed is that the procedure duration was so much shorter with pulse field ablation. It's less than 1 hour as compared to more than 2 hours with RF. So the impact on my practice is that I now offer ablation in frailer and older patients than I used to before.
And if you were allowed to have 1 or 2 words to describe pulse field ablation, what would you say?
So pulse field ablation is extremely interesting because the ablation is at least as good as with thermal, but with a much better safety profile and a much better patient's experience. Yeah. It generates less, tightness in the chest, and patients are recovering faster.
Yeah. Okay, thank you, and congratulations again with the outcomes of your trial. We're looking further to the nice results which are supposed to come.
Thank you so much.
Then we move to Dr. Miyazaki. Could you please describe briefly what is the outcome of the Cornerstone AF trial?
Okay. So in patients undergoing first-time catheter ablation for persistent or long-standing persistent AFib, adjunctive posterior isolation did not improve freedom from any atrial arrhythmia compared with PVI alone.
Yeah. And if you take a look now at your own data, how will the outcome of your trial change your clinical practice tomorrow at the EP lab?
Yes. So based on our findings, in patients undergoing first-time catheter ablation for persistent or long-standing persistent AFib using radiofrequency ablation, I would not routinely perform umbilical posterior isolation.
And in what way do you think the outcomes of this trial will influence the current guidelines?
So additional posterior isolation did not improve freedom atrial arrhythmia. However, improved freedom from repeat ablation, especially in patients in the cryoburn subgroup. So these findings suggest that the impact of adjunctive posterior isolation may not be uniform and could vary depending on the ablation modality used for PVI.
So if you think about the concept of posterior wall isolation, if you could summarize it into a few sentences, what would you say? When should I do it? If ever should I do it? How can you comment on that?
So if the ablation was performed using cryoburn ablation, I would recommend the physicians to do additional posterior isolation. But if the procedure was underwent using radiofrequency ablation, I will not recommend the additional posterior isolation.
Okay. Well, thank you for your comments on this trial. So we need to finalize this conversation. If you were allowed to add 1 more sentence for the audience, what would you add? To start with you, Dr. Jaïs.
Let's focus more on persistent AF, and I think we should also consider not restricting ourselves to symptomatic patients, because I think the harm that this condition is doing to patients doesn't care about symptoms.
No, no. Okay, that's very clear message. Thank you.
Thank you.
And for you, Dr. Miyazaki?
So in patients undergoing first-time catheter ablation for persistent or long-standing persistent AFib using cryoballoon ablation, additional posterior isolation may be considered.
Okay, thank you for your feedback once again, and congratulations with your trial results.
Thank you so much.
Thank you.
Thank you so much.
Thank you also very much for listening.